Hi. For my August presidential message, I wanted to tell you a wonderful story about an accountable care organization in Unity Point, Iowa. Accountable care organizations are groups of hospitals, physicians, and other healthcare providers who come together voluntarily to give coordinated, high-quality care to their Medicare patients. And the goal of this care is to ensure that these patients, especially those who are chronically ill, get the right care at the right time based on their values, their preferences, and their life circumstances, while simultaneously avoiding unnecessary duplication of services and preventing patient errors. And the reason I want to share this story is because ACOs, Accountable Care Organizations, are based on a model of patient care which depends on the teamwork and communication skills training which AACH is committed to providing. So this story is about Phil. Phil's a 70-year-old, and he was one of Unity Point's most expensive patients. He had multiple health conditions, including heart disease. He'd had 2 heart attacks. He had prostate cancer and chronic obstructive lung disease from his smoking. All of this had been paid for by Medicare, but from Phil's perspective, the worst problem was the isolation and depression that he felt when he'd returned to his apartment after being either in the hospital or the rehab facility, where he was all alone, felt sick, and had no social support. He typically spent all day in the chair, too weak, too demoralized to do anything. He was supposed to be taking 17 medications, which would be impossible for any of us, and often would feel too depressed to bother. So his doctor, Dr. Wallace, formed a team to provide care for Phil. The team was made up of doctors, nurses, and home health workers, and the most important person on the team was his home health nurse, Tammy, who visited him weekly to try and engage him more effectively in his care and to make sure that he was taking his meds appropriately and getting some exercise. He felt it was quite successful. As he said, I feel protected now. If something goes wrong, I call them, they get involved. It makes me feel safe. But unfortunately, over the winter, Phil was hospitalized for major depression, and when he got out, he was worried he'd be back to sitting in that same chair for 8 hours a day all alone. Tammy recognized this and knew she had to do something to keep him from slipping back into the depression, and asked him, what did you used to enjoy doing? What did you love? And it turned out that he had been an announcer at a NASCAR racetrack and had been very involved in baseball. So she got him a gig announcing at the Little League games 6 nights a week, which he really enjoyed. And when baseball season was over, she helped him volunteer at the rehab facility where he had formerly been a patient just the year before. So a few times a week now, he goes in, spends time with the residents, and his favorite part is calling the bingo games. So his life now has some meaning. He's no longer isolated. His depression has significantly improved. And that is what patient-centered care really means. Thanks a lot.